Hello and welcome to another intensivecarehotline.com and intensivecareathome.com live stream. Thank you so much for joining me here. Also want to thank you if you are watching this on replay. Really appreciate it. And if you like the work that we are doing here, I would welcome a subscription to my YouTube channel. Subscribe to my YouTube channel for regular updates, that you get notification for the YouTube lives as well. Click the like button, click the notification bell, share the video with your friends and families, and also make comments here so that the algorithm, points you in the right direction for more updates and points other families of critically ill patients to my channel, so we can help as many families in intensive care as possible. Now, before I go into today's presentation, which is Ask Me Anything, answering your questions live for families of critically ill patients in intensive care. I have a whole line of questions lined up here. We get so many questions emailed to us, and I will get to some of them in a minute. I will go for about an hour. You're welcome to post your questions here into the chat pad, or you can also join me live here on StreamYard. I will post the link in a minute, and then you can join me live here and ask me questions live here on the show. Now, before I go into today's questions, what makes me qualified to talk about or to answer questions for families of critically ill patients in intensive care and intensive care at home? Well, I have worked in critical care for nearly 25 years in 3 different countries, where I worked as a nurse manager for over 5 years. And I've looked after thousands of critically ill patients and their families in intensive care before I started consulting and advocating for families in intensive care professionally here at intensivecarehotline.com. Since 2013, we have helped hundreds of families in intensive care, including saving their loved ones' lives. It's no exaggeration. We have saved many lives in intensive care, where intensive care teams wanted to prematurely withdraw treatment, and we have intervened successfully many times, and you can verify that on our testimonial section, and you can verify that on our podcast at intensivecarehotline.com with some client interviews. I'm also the founder and managing director of Intensive Care at Home. We are sending critical care nurses into the home for predominantly long-term ventilated adults and children with tracheostomies. But also we provide home BiPAP, home CPAP. We provide home tracheostomy care when adults and children are not ventilated. We provide home TPN, IV potassium infusions, IV magnesium infusions. We provide IV antibiotics at home, palliative care at home, as well as port management, PICC line management, Hickman's line management at home, and central line management at home as well. So, and you get more information about intensive care at home at intensivecareathome.com. And, we are currently operating all around Australia with intensive care at home, in all major capital cities, as well as in regional and rural areas. And we are also accredited for NDIS for intensive care at home, TAC in Victoria, NIISQ in Queensland, ICARE in New South Wales, DVA all around the country. We have received funding through public hospitals, departments of health, as well as private health funds. Now, and we also provide NDIS level 2 and level 3 NDIS support coordination with intensive care at home. Now, moving along. So, hi, William. Nice to see you again. Patrik, you and your organization is wonderful. Thanks for all you do. Thank you, William, for the kind words. I really appreciate that, and I pass that on to my team as well. I appreciate your support. Thank you so much. Now, let's get on to the questions that have come in during the week. Questions and comments, I should say. Sometimes we also get comments that I read out, and also if anyone on this call wants to join me here and ask questions live on the show, you can either type them into the chat pad, or you can join me here on StreamYard. Now, moving along. First question for today comes from Mark, who says, 10 years after an unattended heart attack, no oxygen for 20 to 30 minutes. I could not articulate nor remember anyone's names, including my family. I didn't think of hygiene for months. I lived alone in a new town with few acquaintances. It seemed to have killed everything but my body. The first 4 years, I wished for death, but after that, things began to change. Now, 10 years have passed, and most physical attributes have returned. Deficits still: comprehension of written materials, senses of taste, hunger and fullness, smell and pain, with the latter being most amazing and terrifying. Speech was poor and devoid of eloquence, most disturbing when answering doctors' "where does it hurt?" questions. Small motor skills on my left side was unnerving and saw me dropping tightly gripped items often. When walking, I seemed to only turn left. For 2 years, I kept biting the inside of my left cheek. I still have scars. A certain OCD crept into my life. I use only colored plastic hangers and was befuddled. I hadn't the right matching color to match the garment. I love my morning coffee, but found myself pouring barbecue sauce as a creamer or possibly a sweetener over and over for months, wasting pots of my morning goodness. Eating is now for texture and visual pleasantry. I remember my favorite foods and what they tasted like. I must eat by a schedule to remember when to eat, for that I've already eaten. Short-term memory is a struggle, and organizational skills are truly non-existent. I had worked with stroke patients and kept reminding myself of how wonderfully plastic the brain is. Note: the only help, and Mark puts help in quotes, I had was from my librarian, who showed me how to use my computer and got me started with online brain exercises. Well, Mark, I'm gobsmacked by your email here. Speech certainly now is eloquent. And this is, Mark, thank you so much for sharing this. I think, anyone watching this and listening to this, this is another sign that you can never give up. You can never give up. Imagine Mark or his family would have given up on him at the time of his cardiac arrest. He wouldn't be writing such an email, right? Many families in intensive care say, "Oh, I don't want my loved one to suffer." I am sure that Mark suffered tremendously. I am sure that Mark, to get to this point, to write this email, he suffered tremendously, right? But now he's on the other side. And some people might look at Mark and might say, "Well, I wouldn't want to live like Mark." Well, that's not what I'm hearing from Mark. I'm hearing from Mark that he enjoys every minute of his life, right? So you can never give up. He had a cardiac arrest, no brain perfusion apparently for 20 to 30 minutes. That's what he writes anyway. So this is such a wonderful email from Mark, and should give hope and clarity to all families in intensive care what to do, which is to never give up. I've made countless videos about real versus perceived end-of-life situations in intensive care, and I'm sure that everyone told Mark's family to give up and, he won't have any quality of life. But again, that would have been a perceived end-of-life situation, not a real end-of-life situation. A real end-of-life situation is that no fancy treatment, no surgery, no fancy medications, no nothing, no equipment can keep someone alive. That is a real end-of-life situation. And there are some of them in intensive care, of course, but there are more perceived end-of-life situations where someone has a perception without checking reality, right? And the one that's checking reality here is Mark in his email, right? we need to listen to people like Mark, right? Life is sacred, as it's written in the Bible. Life is sacred, and we must preserve life at all costs. So, thank you, Mark, once again for writing in. Let's get on to the next question. I think I briefly did touch on that question last week, but I think it was a lengthy question. I didn't get to answer all of it, so I'll quickly read it out again. This is a question from Heather, who says, I have a loved one in ICU. My baby brother was in a coma since the day after Christmas. They had him at another hospital 2 hours away. The hospital was trying to push us to remove his ventilation and let him go and die. They had told us he was unresponsive, wasn't awake often, and that he was brain dead. They said no activity, he wasn't breathing on his own. We didn't want to do so, so we declined the topic. He was moved back to the hospital locally 3 days ago. We went to speak to the care team, and he was awake. He was tracking movement with his eyes and would look at sounds. Now, with that being said, he wasn't able to respond to commands, but it was his first day awake almost all day. He does jerk his feet away if you touch his toes or try to tickle. He will hold eye contact for short periods, then wander off from it. I believe he has tried to acknowledge a statement once, but I'm not sure if it was just good timing for a weird sounding horned to a very impactful statement from his oldest son. Also, we put his stepmom on the phone for him to hear. Again, I'm not sure if this was another perfect time, not if a weird neurological response, but if he had a face of upset and wanted to cry, then a single tear rolled down one cheek. When I went to wipe the tear, he reacted with his eye as if he knew I was moving my hand close to him. He responds to touch, rubbing of the head and belly. Like a baby does, his eyes roll like it feels good. So I'm not sure what is what. He overdosed and was laying there a long time. He does have brain damage from lack of oxygen, unknown time. I'm just looking for answers and hope so we can make the right choices for him. I'm grateful for all the helpful information from Heather. So, well, again, thank you, Heather, for writing in. So, once again, the number of people that I'm talking to here at intensivecarehotline.com, where families get told their loved one is brain dead, but no brain death testing has been done. If brain death testing has been done, in many instances, brain death can't be confirmed, right? There's a big difference. Also, there's a big difference between someone being brain dead and someone being brain damaged. It sounds like your brother might be brain damaged, but obviously he seems to wake up, and he will need time, right? Imagine this: you're letting your brother go now without trying everything, right? Is there a return from that? Well, as far as we know, there isn't, right? What if you keep trying? What if you keep trying? You remember the email a minute ago from Mark, what he was saying, so it's clear what you need to do here. You need to keep trying. Only time will tell you. Always think about this. Make decisions today that you don't regret in 12 months, 24 months time. Always think about that, right? And I know your next question is, how long is a piece of string? How long is it until you wait for your brother to wake up to get better? No one has the answer to that. But one thing is for sure, you not trying, you and your family not trying, you know the answer already. You know the answer already, right? So, and I also encourage you to look at our testimonial section for intensivecarehotline.com, because we have saved so many lives through our consulting and advocacy. We have prolonged life when people wanted to prolong their life. We have also helped families to get end-of-life situations on their terms, not on the hospital terms, right? And that could include having end-of-life care at home with intensive care at home. It could include a number of scenarios to have an end-of-life situation on your terms. However, I don't think that is what's needed here, Heather. I think your brother seems to have much life left in him, right? So, Also, have a look at our podcast section at intensivecarehotline.com. I did a podcast with a client of ours last year where the client was in ICU. ICU wanted to withdraw treatment. The family nearly gave in. He had a traumatic brain injury and a cardiac arrest. The family nearly gave in, but they did make one phone call to us here at intensivecarehotline.com, and I said, well, let's intervene here. And we successfully intervened. And the client sits on a podcast probably a year later. He was doomed to die in ICU because ICU told the family, well, you're not going to live, you're going to die tomorrow, sort of thing. Well, their judgment was not correct, was very incorrect, and it could have cost a life without intervention, right? So if you are not doing your due diligence, if you are not doing your due diligence, it could cost your loved one's life, right? And like another example here is, and I hope you don't mind me saying it in case you're watching this, Scott Scara from Wisconsin. I've had Scott here on a YouTube live and on a podcast. Scott lost his daughter, his 19-year-old daughter, in ICU in October 2021 in Wisconsin. And he didn't do his due diligence, and he admits that openly. He's got his own podcast now. And, he thinks that the ICU killed his 19-year-old daughter, and he's taken the hospital to court. When you have time, Google Scott Scara and My Amazing Grace. Grace was the name of his late daughter. He's fighting a worthy cause, and he's fighting probably for many other families as well. So Scott, if you're watching this, I hope you don't mind me mentioning that, because I know how passionate you feel about fighting the good fight here. Okay, let's keep it moving, and let's move on to the next question, which comes. The next question is coming from Gaia, who says, ICU is forcing my family member out of ICU with a tracheostomy. Okay, so thank you for asking that question, Gaia. So first off, you didn't share where your loved one is going, but your best bet here is intensive care at home, right? A lot of it depends what else is going on. Does your loved one need rehabilitation? But the reality is that not many patients outside of intensive care are safe with a tracheostomy. Looking after a tracheostomy is an intensive care nursing skill, and it's an intensive care nursing skill only, right? There are some nurses that work on ENT wards. They would probably be familiar with tracheostomies as well, but you will find the majority of tracheostomies are in intensive care, and that's where most of the training is taking place for tracheostomy. That's where people really get proficient with tracheostomies. So that's one of the reasons why we created intensive care at home, because we know that ICUs are trying to push patients out with a tracheostomy, and they're trying to push them out to hospital wards, hospital floors in America, to LTAC, or to rehabilitation centers. Many patients have died in those places because the staff are not qualified to manage tracheostomies safely, right? And that is evidenced with the mechanical home ventilation guidelines that you can find at intensivecareathome.com. When you look at the mechanical home ventilation guidelines, they are evidence-based. In a home care environment, only critical care nurses with a minimum of 2 years ICU or critical care experience can safely look after ventilated or tracheostomy adults and children in the community. Well, if that's the case in the community, it's the same outside of ICU. Really, there is no place outside of ICU for tracheostomy clients unless they have a critical care nurse with them 24 hours a day. Like I said, I can give you countless examples, countless case studies where adults and children have died in the community because they didn't have a critical care nurse with them 24/7. It's the same in LTAC in the US. It's the same on hospital floors. I can give you countless examples. So I hope that answers your question there, Gaya. Your best bet is to use intensive care at home. Go to intensivecareathome.com, call us on one of the numbers on the top of our website, or send us an email to info@intensivecareathome.com. Now, I'll carry on with the next question. If you have any questions, please type them into the chat pad here, or click on the StreamYard link and join me here on the call, and I can answer your questions live on the call. You don't need to go on camera. You can just talk to me even if you don't want to go on camera. Okay, let's move on to the next question from Carrie Ann. Carrie Ann says, "Hi Patrik, I'm not being able to talk to someone after my significant other transferred to another facility to no ventilation, MRSA, COPD, congestive heart failure. My loved one is, and what's being done, and who is his doctor? What care is he receiving? I have no idea because he's been taken away to another hospital far away." Wow, that's a powerful situation and not a good one. I understand that. Well, the first question is here, are you, when you talk to significant other, I presume this might be your husband or your life partner or boyfriend or, whatever relationship you have with your significant other. First question is, are you the power of attorney? If you are not the power of attorney for whatever reason, it'll be very difficult for you to get a handle on this situation, right? So the first thing is, are you the power of attorney? And I would strongly recommend you become the power of attorney. If you don't know how to become power of attorney for your loved one, you should talk to a family lawyer. Once you are the power of attorney, get access to the medical records, right? Once you're the power of attorney, call us here at intensivecarehotline.com, and you and I can talk, and we can get on a call to the doctors as well, because getting on a call with the doctors will make all the difference. And then I can ask all the questions that you haven't even considered asking, but you must ask when you have a loved one in intensive care. If he's ventilated with MRSA, COPD, congestive heart failure, he might have challenges getting off the ventilator. I can see that straight away, right? So, with congestive heart failure, is he potentially in an irregular heart rhythm? Is he getting inotropes or vasopressors? What is his ejection fraction? Has a cardiologist been consulted? With COPD, has a pulmonologist or a respiratory physician been consulted, right? So I know you've got a lot of stuff to work on here, Carrie Ann, but very important that you get started as quickly as possible. Okay, let's move on to the next question from Lashvili, who says, "Hi Patrik, my 3-year-old son is in a coma, or has been in a coma for 7 months. 1 month there was no reaction. Now he has all reflexes almost slowly coming back. When he breathes through a tracheostomy, the device shows as if he is breathing. We have not yet found out whether it is so or not. Please help me," from Lashvili. And Lashvili attached actually a picture of the ventilator there, which I'm just looking up. And what can I see on the ventilator? Yeah, it looks like your son is breathing mainly spontaneously, but on very high PEEP and pressure support. So that needs to come down. It looks like your son is breathing on BiPAP, right? And if PEEP and pressure support cannot come down, it'll be difficult to get him off the ventilator, right? But the good news is if his reflexes are coming back, and if he's breathing by himself now on BiPAP, then that is definitely a good sign. You should not give up hope here. Question is, what else are they doing to wean him off the ventilator? What else are they doing to wean him off the ventilator? What else are they doing to mobilize him, to work on his reflexes? Are they doing any physiotherapy, rehabilitation already? Right? The other challenge here is Lashvili, he's on 60% of FiO2. That is a lot. So FiO2 would need to come down to at least 40% before you can even look at ventilation weaning, right? And PEEP and pressure support would need to come down as well. But the first email that I read out today from Mark, who said, look, it took him 4 years to recover, and Mark is a grown man, you should definitely have all hope in the world for your son. You should definitely have hope for your son here, that he's going to turn the corner. What is 7 months, if, your son is 3 years old, what is 7 months? Is that a lot in hopefully a long life? So I think you should not give up here. And thank you for sending through the pictures, because that always helps me to interpret what's happening. Other things you need to be looking at, Lash, really is how often do they suction him? Do they suction him hourly? Do they suction him 3 times a day? It's a big difference. Is his lung compliance good? From what I can see on the ventilator, there seems to be no issues with compliance. Right? But why is his FiO2 still 60%? Why? Does he have lots of secretions? Does he have a pneumonia? Does he have ARDS? Right? Those are questions you need to ask. Does he have any other infections? Is he opening bowels regularly? Is potentially, if he's not opening bowels and his tummy is firm, is that putting pressure on the lungs? Is he absorbing his feeds? I presume your son would have a nasogastric tube or a PEC tube, or potentially a patch tube. Right? But you should not give up here by any means. Okay, let's move on to the next question. From Rob, who says, "Hi Patrick, my wife has terminal cancer and is in intensive care, and all the nurses want to do is give her pain medications rather than, getting her better and trying to help me to get her home." So look, I don't know how, I'm very sorry to hear about your wife's situation, Rob, but it's difficult to say whether, at the end of someone's life with terminal cancer, if they don't want pain medications, that's fine. Then it needs to be documented. Is that the right thing to do? I don't know. I would imagine there would be a lot of pain if your wife was has terminal cancer. Have you considered taking her home for end of life care? Once again, have you considered intensive care at home to get her home? You can get palliative care services involved as well at home. Should she be mobilized? Should she get out of bed? Does she want to get out of bed? I cannot answer you that question, but What do you want out of this situation? Where do you see your wife's quality of life or quality of end of life in those potentially last few days? What is it that you want to achieve? What is it that you would like to achieve? Have you thought about this, Rob? With intensive care at home, we have provided many palliative care situations at home in situations like that. Okay, let's move along to the next question. From Deborah. This is also a comment from Deborah, who says, I've been there. I died for 26 minutes, spent weeks and months in a coma, spent 1 year in rehabilitation, learning to talk and walk again. But that was in 2009. Now in 2024, I never give up, keep going, good. I'm sending you all love and luck from Nottingham in the UK. This is a comment from Deborah on my YouTube channel. So thank you so much again, Deborah, for sharing that and giving families hope watching this. Very important message here from Deborah, that once again, you should never, ever give up. And then another comment from Jeddah. Jeddah says, thank you so much for this video. My dad had a diffuse cerebral edema after a cardiac arrest. He was induced in a coma for like 14 days. Now he's recovering. He's already opened his eyes and has some small movements in legs, mouth, and hand. I do have hope. Well, thank you, Jeddah, for sharing that as well. Well, here's the thing. Let me read this out from Jeddah again, because I think this is a really important message, where she says, thank you, Patrik, so much for this. My dad had a diffuse cerebral edema after cardiac arrest. He was in an induced coma for like 14 days. Now he's recovering, already opening his eyes, and has some small movements on legs, mouth, and hand. I do have hope. Well, other families might say, well, all he does is slowly opening eyes, and all he does is small movements on legs, mouth, and hand. What's the point? That's what other families might say. So it's really a glass half full versus a glass half empty situation. And I would say, Jeddah looks at it like a glass half full situation, and that's how I would look at it. You got to be grateful for what's there. You got to be grateful for what you've got, not ungrateful for what isn't there. Focus on the positives, not on the negatives. Right? That is really critically important. Okay, thank you so much. Now, if you have any questions while you're watching this here, type them into the chat pad or join me on StreamYard Live here, and I can answer your questions there. Okay, let's get on to the next question from Javia. Javia says, hi, Patrik. My brother recently had a massive accident in Tennessee on the 3rd of July. He went into trauma followed by cardiac arrest, which led to him losing oxygen supply to his brain, and his ECG, MRI, CT scan shows no signs of major injury, but it's been 14 days. My brother hasn't responded. He's currently in the ICU unit. The doctors believe there must be an anoxic brain injury. I'm terrified though, because we all live in India and I can't go there because of travel, because I can't get a visa. It's been a very rough situation. I really have hope he will respond, but would take some time for recovery. Could you please help me? Sure. So, again, if you've watched this today, there have been so many positive messages from other families of critically ill patients in intensive care and patients themselves saying, well, look, I was in a really bad situation. I was, supposedly having an anoxic or hypoxic brain injury, and now I'm writing you an email, right? So, it's critically important that, you follow your own instructions and you keep advocating for your brother, get access to the medical records, get you and I to jump on a call with the doctors, you know, so I can ask the questions on your behalf, you know. So, and the reality is that after 14 days in an induced coma, with or without a brain injury, patients have difficulties waking up. That's not a novelty. That is absolutely not a novelty. Many patients in intensive care that come out of an induced coma that have no brain injury whatsoever can take days, sometimes weeks, to wake up as well. Right? So do not give up hope. Watch the video from the start where I read out many comments from readers who have survived similar challenges, right? Against all odds. Against all odds. Okay, let's move on to the next question. From Herman. Herman says, "Hi Patrick, my mom has been on a ventilator, the lowest setting, for 21 days now, and we are being pressured to put in a tracheostomy with no other options." Okay, wow. So, if you are in a situation like that, when you say lowest setting, so she must be breathing spontaneously on CPAP or pressure support, I tell you what the lowest settings are actually. Lowest settings for an adult are, they must be breathing in CPAP or pressure support with a PEEP of 5, no more than that. Pressure support of 8, no more than that. Tidal volumes, the volumes that your mom is breathing, must be around 7 to 10 mils per kilo. So for simplicity, if your mom weighs 60 kilos, let's just take 10 mils per breath. She would need to breathe around 600 mils per breath, right? The breathing rate needs to be between 8 and 20, 22 at the most, right? And they all must be spontaneous triggers. The arterial blood gases must be, PO2 must be above 70 or 80 millimeter per mercury. CO2 must be within normal limits, which is 35 to 45 millimeter per mercury. pH must be normal. Your mum must be obeying commands. She must have a good strong cough. She needs to be almost at the point where she can cough out the breathing tube herself, right? She must be off sedation, off opiates, right? And if all of those boxes are ticked, there should be no reason why your mum can't have the breathing tube removed and avoid the tracheostomy. There should be no reason for that whatsoever. So the question here, what's the missing link? Right? What is the missing link here? Is the missing link that she's not waking up? Is the missing link that she can't obey commands? Is the missing link that her arterial blood gases are poor? Right? There are plenty of patients who need CPAP or BiPAP and are not ready to be weaned off the ventilator. They're not ready to be extubated because the PEEP is too high, pressure support is too high, tidal volumes are too low. Right? So that is the challenge that we are facing here. Okay. So there could well be a good reason why your mom needs a tracheostomy, but you need to find out why. I've done a video, how to wean a critically ill patient off the ventilator in the breathing tube, right? Go to intensivecarehotline.com and type that into the chat pad. How to wean a critically ill patient off the ventilator in the breathing tube. And you can watch the video there, or watch the video there, or read the blog post. And that'll be a guide for you. But another guide for you is, to simply book me for an hour and we'll talk to the doctors and nurses directly and we'll work out what's happening. Or we'll look at the medical records, either or. Best is do both. Once again, The biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. That's exactly what you are dealing with here, Herman. You know, what I'm also finding over and over again when I talk to intensive care teams directly, intensive care teams are not even telling you half of what's going on. You can only find out what's going on if you know what questions to ask. You know, only then can you really find out what's going on, right? So that's why the one-on-one consulting is so important. You know, you need to stop dabbling around, and you need to get someone on your team who knows what questions to ask. Most families have no idea. Okay, before we move on to the next question, type your questions into the chat pad or join me live on the show here. I put the StreamYard link there, and you can ask your questions here. If there are no other questions, I will read out the next question from Jonathan, who says, recently, I was in a medically induced coma for a few days, shy of 2 months. Due to cellulitis growth on my neck, which was rapidly swelling, they called me the astronaut. While I was in my comatose state, I had extremely vivid and some terrifying dreams, as well as few dreams which were okay. I was told that they had a very difficult time of keeping me alive for as many as 4 times. I needed to be restarted. In my dreams, I remember every dream in chronological order as they came. I even had to watch myself perish multiple times. Is this a common occurrence? Well, Jonathan, thank you so much for sharing this. I don't know. I really don't know whether it's a common occurrence or not. I can tell you from experience, after having looked, after thousands of critically ill patients and their families, and, after talking to so many families and patients over the years, there are patients who would describe a similar experience, and there are other patients who would have no recollection of what's happened whatsoever. So it is not a one size fits all. It is not a one size fits all. Okay, so whatever happened. Again, Jonathan, I'm very happy to hear that you've gone through this and you've survived, and not happy that you've gone through it, but very happy to hear that you've survived and that you encourage other families. I really appreciate your comment here. Next comment is from Ronald, who says, I was in a medically induced coma for a month and a half due to necrotizing fasciitis and sepsis. The dreams were horrifying. I thought it was real and it would never stop. It took 2 weeks to learn how to walk, write, and 4 weeks to speak. I wouldn't wish it on anyone. Thank you, Ronald, for sharing that as well. Once again, it's different for different people. And I know people do suffer when they are in ICU and when they do go through this. But, I'm also very grateful that both Jonathan and Ronald share their experience here so that they can bond with other people here who might have gone through a similar situation. But it's also hope for families watching this that, there are people on the other side. Most people are on the other side, and the other side is good. That is also very important for you to understand, that the other side is actually good. So let's keep it moving, and let's move on to the next question. If you have any questions, type them into the chat pad here, or join me live on the StreamYard here, and you can ask me questions there. Let's get on to the next question. There's a comment from Modema, who says, praise God for you, Patrik. I've been recommending your services lately because regrettably I found you too late. I know what it's like. Well, thank you, Modema, for that kind comment. I know you've been on this show many times asking questions and supporting other families as well. Thank you so much. Okay, next question from The next question is from Donna, who says, "Hi Patrik, I want to understand why my sister is not waking up in an induced coma. I'm fearing of ICU doctors pressuring me to consent to DNR or no resuscitation, and I have not been provided with enough information about my sister's condition. Can you please help?" Well, thank you so much for your question, Donna. Look, there's certainly a lack of understanding for families of critically ill patients in intensive care, but it also comes down to not having advocacy. It also comes down to doing what 99% of the families of critically ill patients in intensive care are doing, which is they're not asking the right questions, they don't know what to look for, and they don't know what they don't know. They don't know their rights, right? So clearly you need help here, Donna, and you need not to give consent to a DNR order. You don't have to. No one can force you for that, and they don't have a right to issue that order, right? So that's been shown in many court cases when you look that up online. No one can ask you to give consent to a DNR if you know that's not what your sister wants, right? What is important here is you need to get power of attorney. Unless you have a power of attorney already that's doing the right things. Why is she not waking up after an induced coma? I don't know. Is she still on sedatives? Is she still on opiates? Right? Does she have a brain injury? Right? You are saying, I want to understand why my sister is not waking up in an induced coma. Well, if she is in an induced coma, of course she's not waking up, because she's in an induced coma, kept in an induced coma by medications, by sedatives and opiates. Now, you're saying fear of ICU doctors pressuring me to consent to DNR and not providing me with enough information. Well, you are responding to an outside event, right? You are responding to ICU doctors' perceived pressure. Well, that is your choice. You choose to respond to that. You can also choose not to respond to that, right? So which one do you want? Do you want to choose to respond to fear? Or do you want to choose not to respond to ICU doctors scaring you? I know which one I take, right? ICUs are very good to pretend they can do whatever they want. Well, issuing a DNR doesn't happen in a vacuum. It happens around policies, procedures, laws. End-of-life care does not happen in a vacuum. Okay? So, and once again, what you need here is consulting. Call me here at intensivecarehotline.com, and then we can get on a call with the doctors and nurses directly. Why is she not waking up? I will help you getting access to medical records. Okay, so that's my advice here, Donna. Now, William, you are saying, if you are in the ICU, is it always best to go home for intensive care at home versus LTAC? No, it's not always, but most of the time. So here's what's the goal with intensive care at home. Intensive care at home is only really the right solution if someone can't come off the ventilator and a tracheostomy, right? Or if someone is in ICU stuck on BiPAP, CPAP without a tracheostomy. Or if someone is stuck in ICU with a tracheostomy but is not ventilated. That's when intensive care at home is the right solution, right? LTAC, from my experience, is never the right solution. It'll only cause grief and pain for families in intensive care. I can't remember the ins and outs, William, when we were working with you one-on-one last year, whether your dad was in LTAC. I can't remember now off the top of my head. But, many families go in, or many patients go into LTAC, and the very next day, or within often less than 48 hours, their loved ones bounce back into ICU, right? And then they're finding that when they bounce back into ICU, they're bouncing back to another ICU. So picture this, your dad is in ICU, then he goes to LTAC, and not even 24 or 48 hours later, he's bouncing back into ICU, but then he bounces back into another ICU, right? So he'll be in 3 different places within 48, 72 hours. That is madness, as far as I'm concerned. That is absolute madness, as far as I'm concerned, right? So intensive care at home is the right solution for long-term ventilation and tracheostomy, for long, slow, prolonged weans, weaning off the ventilator, or for patients that cannot come off the ventilator. That could be high spinal injury, C1, C2, C3, cerebral palsy, motor neuron disease, right? But also COPD, inability to wean off the ventilator because of prolonged induced coma. Intensive care at home is absolutely right there. Or for patients that need BiPAP, CPAP, for medical conditions, not for sleep apnea, that potentially have a PEG tube, that potentially have nasogastric tubes, that potentially have seizures, right? That's when intensive care at home comes in. Also for home TPN, central line management, PICC line management, Hickman's line management, as well as port management, right? But LTAC, from my experience, is never a good solution, William. And from memory, I think with your dad, it wasn't a good situation. I just quickly need to bring up your file and just to memorize what we did in your situation, if you don't mind, so that I familiarize myself with, again, with your dad's situation. In the meantime, if you have any other questions, please type them into the chat pad or join me live on the StreamYard link. Having said that, I will wrap this up reasonably shortly. I do have room for one more question while I'm looking up, William, I'm looking up your file when we worked with you one-on-one, just to get it back into my brain what the situation was. I do remember your dad was in a hospital far away from home, from memory. And also, William, going from ICU to home, it's not a large number of patients. We are talking about the minority of patients. It's very much a niche market, or a need that is only needed for very few patients, but it is a great solution for the right patient and the right family. It's the best solution, and it's also the best solution for an ICU who's struggling for beds, who keeps charging $5,000 to $6,000 per bed day. Just looking that up. Your dad suffered a cardiac arrest. This was last year in November. And I believe he had a tracheostomy, from memory. And I remember you were trying to go back home from the LTAC that your dad was in. Anyway, let's move on to let's wrap this up here today. Sure, it's a pleasure, William. It's a pleasure. Okay, so let's wrap this up here today, because we get so many questions from families in intensive care. That's why I do a YouTube live every week. I usually do it on a Sunday morning, 10:30 a.m. Sydney, Melbourne time. That is currently 7:30 p.m. Eastern Standard Time on a Saturday evening, 7:30 p.m. That is 4:30 p.m. on a Saturday afternoon Pacific time in the US. It is just 24:30 when I start these calls. No, 11:30 p.m. in the UK, currently on a Saturday night. and I do them every week, once a week usually. Now, because we get so many questions, we also created a membership for families of critically ill patients in intensive care, that you can become a member of if you have a loved one in intensive care. And you can become a member, and you can get access to the membership if you go to intensivecarehotline.com, and if you're clicking on the membership link, or you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all your questions intensive care related. You also have access in the membership to 21 ebooks and 21 videos that are exclusively accessible for members only, and that help you make informed decisions, have peace of mind, control, power, and influence when you have a loved one in intensive care. And it'll help you to make sure your loved one gets best care and treatment. Right? I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. And I talk to you and your families directly, and I help you to understand the things that you don't know, that you even don't know. Right? You need to find out the things you don't know that you even don't know. You need to find out what questions to ask, what to look for. You need to find out your rights. You need to find out how to manage doctors and nurses in intensive care. That is what I can help you with very, very fast. Right? I also represent you in family meetings with intensive care teams. And I make sure you have a strategy when you go into meetings with intensive care teams. I make sure that going into a meeting with intensive care teams is the right thing to do, because sometimes it's not. Right? Again, families in intensive care don't know what they don't know. Furthermore, we also offer medical record reviews in real time so that you can get a second opinion in real time. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com. Once again, if you're in Australia and you need intensive care at home, we are currently operating all around Australia in all major capital cities, as well as regional and rural areas. We are an NDIS approved service provider. We provide NDIS level 2 and level 3 support coordination. We are a TAC approved service provider in Victoria. We can also help you with a TAC support coordinator. We are an iCare approved service provider in New South Wales, NIISQ in Queensland, DVA in all around Australia, as well as we have received funding through public hospitals, departments of health, as well as private health funds, so we can help you with funding one way or another. And that's for the wrap up today. If you're an NDIS support coordinator and you're looking for nursing care for your participants, or you don't know how to get nursing care through the NDIS, I encourage you to reach out. We're also offering NDIS nursing assessments. And I want to thank you again for watching this today. Thank you for your support. If you like my video, subscribe to my YouTube channel for regular updates for families in intensive care. Give the video a like. Subscribe to my YouTube channel, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have. Thanks for watching. This is Patrik Hutzel from intensivecarehotline.com and intensivecareathome.com, and I will talk to you in a few days. Take care for now.